Just curious to ask you, what would be the difference on this last edition comparing to the previous one?
Yeah. And that's a great lead into, today's practice, maybe with my perspective as an older, person. It's what's changed. And what I'm excited about is that we have way more evidence for the benefits of exercise, subtext, the benefit of physiotherapy, than we did in earlier editions. And it's actually been more than 10 years since the fifth edition. So there's, no one has a recent edition because it gets this issue of how quickly can you pump a book out. And Peter and I aren't, and our co-authors who do all this hard work, we're not in the business of just having books for books' sake and trying to make money. Honestly, authors will tell you that they actually don't make money, and it's just the publishing industry isn't the way to make a lot of money. I think AI is, and stocks, and there are other ways of making money, real estate. But we just takes us that time to put the quality product out and work with the authors, and we wait for the field to have changed. So, we have all this new evidence, all these randomized trials that you know very well, in the sense of, randomized trial after randomized trial coming out in the leading journals like JOSPT, British Journal of Sports Medicine, Physiotherapy. These journals are packed with literature, and I'm a full-time academic and I can't keep up with the quality of work, the volume and the quality of work that's coming out in our field, as you know, and as your listeners will know, because your listeners are keen and they learn. So that's very different, because when, the first book was being written, we were saying, well, we think manual therapy works, or, we think exercise works, like go try it maybe. And there weren't any publications, not even a case series in a lot of cases. And the idea of randomized trials, that's for the younger listeners, it'll seem like a pre-internet era or pre-iPhone era. There weren't randomized trials in our field because the universities didn't prioritize sports physiotherapy, sports medicine. So there were hirings in cardiology and hirings in cancer, but there was no professors in our field. So it's hard to get, and the grants weren't being given to sports physios, whereas now you've got people like Kay Crosley, and Claire Ardern, and, these big name physios who are getting grants because they're professors and they're able to get into the funding agencies at the national level with millions of dollars of grant opportunity. And by being super in their work, they're able to get these grants.